Hi, my name is Kemi, and today I will be talking about mental health. Health is defined by World Health Organization as health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Mental health is included in that definition and should be discussed and addressed at the same level as a physical ailment. There is an increase in distrust in communities of color of the healthcare system. One of those reasons is due to the lack of representation of those of color as healthcare professionals. Diversifying workplaces to better represent those in communities of color will help to dismantle this barrier of distrust, providing a safe place for those of color to receive treatment. Secondly, implementing mandatory culturally competency for those working within a mental health care system. This is important as availability of healthcare professionals who belong to communities of color may not meet the need of the population that require mental health services. Training on cultural competency will allow for assessment of where the healthcare professional is on the continuum of cultural competency. This will further help to dismantle the barrier of distrust with communities of color by ensuring cultural awareness in the delivery of treatment. Lastly, minimizing health disparities. The lack of funding is a barrier for communities of color accessing the mental health care system. Lack of funding can include insurance companies not providing coverage of mental health services, especially government assistance programs, which must be discussed when talking about communities of color. This must be addressed to better service communities of color in the ethical code of beneficence. Advocating for allocation of more funds to the sector of mental health will assist to decrease health disparities in communities of color. Also included in health disparities is education of the benefit of mental health services. This must be intentionally conducted to ensure that communities of color are aware of the help that is available to them. With implementing these changes, I believe that we can make the progress for those in communities of color being able to achieve a state of complete health. Thank you for your time.